Our session now on PACES23 clinical communication. Bismillahirrahmanirrahim. And today we will be discussing how to be an expert communicator in this new pattern of PACES23. I will try my level best to teach you exactly some basics of the clinical communication. And also, we are already doing that in our current scenario, our current pattern of paces. But yes, there are now few more, refinements which are coming ahead in paces 23. Inshallah, likely it will be, implemented from the diet 3, this diet 3. So now, what is the agenda today and what we are about to discuss today? First of all, I will teach you exactly now what are the basics of communication. How to communicate well in your clinical communication station, and also what are the new changes which they are bringing in PACES 23. Yes, the changes are slight, but sometimes the slight changes do have a big impact. And also, it is important to delineate the different things, especially the timing, especially how to perform the same quality of communication in that short time. So let's start our session. And Dr. Satinder, please keep your mic unmuted, okay?
Yeah.
Good. Dr. Satinder. So I am sharing my screen for you people. Just a second. Okay, I think that we are all set. So, Dr. Satinder, are you able to see my screen now?
Yes.
Good, very good. Is it clear?
Yeah, it's clear.
So today we are focusing more on a communication skill, and last week we were discussing the short clinical consultations now, which are now no more short, rather they are giving you 15 minutes to perform that history taking as well as the examination. This time, this station, that communication station, is now slightly changed, and we should really be very realistic, and also we should be up to the mark to digest, not only digest, rather absorb all the new changes which are coming in our exam. So if we really want to pass the exam, if we really want to be a good candidate, it is really important for you to be ready for any new challenges which are appearing in your exam. So this presentation, of course, is more focused on PACES 23 communication skill station. But yes, if you are appearing in DIET 2, inshallah, it will really help you, because we are about to cover everything regarding clinical communication station. Now, remember that it is not about how much do you know. It is not about exactly how in-depth knowledge you have for a particular disease. It is about exactly, as I was saying previously, what they require and what they want. Remember that we have really a very short time, and we need to make a deep impact in that short time. Previously, this time was 14 minutes. Right now, in this new PACES 23, it is 10 minutes. So you have the 10 minutes. You have the 10 minutes to impact your examiner. And of course, this is a chance for you to prove yourself that you are an adequate, confident, sympathetic, empathetic, and up to the mark communicator. Communication, remember that it is really not only the clinical communication that you are telling about the disease, you are telling about its management options, and you might be telling about its sports, like might be physiotherapy or something like that. It is even about your words. It is even about your tone of the voice. It is even about the way you are sitting in front of the patient and your eye contacts. Remember that communication is something which really tests your way to convince other person, and also how much empathetic you are. Remember, it is your duty, not only duty, rather it is a must for you to change yourself according to a scenario which is being provided to you in your PACES. Might be you are dealing with a simple scenario in which you have to explain IBS to the patient. Might be you have to explain the patient that he is having some widespread cancer which is not now amenable to treatment. So now you will be more empathetic and more sympathetic. Similarly, might be you're discussing with a death scenario with the son that the dad is no more there. Might be you are dealing with a scenario in which you have to talk about organ donation with a person, and might be he is having some sort of confusion or some sort of misconception that this is not a right thing, or might be a doctor is having some primary or secondary gain in organ donation. You have to rectify those concerns and those misconceptions. Sometimes the person is really angry and he is saying to you that I will sue you in the court, and you have to admit your mistake and you have to rectify the things by being very empathetic and considering that if same thing is happening to you, how you will communicate. So it is all about knowledge, not only the knowledge how you are sitting in front of your surrogate with the your examiners looking on you, and also it is not only just that how well you can speak English, or might be how well you have the convincing power, or might be you are having a good knowledge of that particular subject. Not only this, but yes, this communication station do require you adequate knowledge of the legal consideration, legal issues which you might face in that particular scenario. And also it is important for you to have a sound and good knowledge of ethical consideration along with medical issues in one particular scenario. Dr. Satyendra, my voice is clear?
Yes, yes,
Fully clear?
yes.
Good.
It's fine.
Now, I will start my presentation with this one quote that communication is only effective when we communicate in a way that is meaningful to recipient, not to ourselves. This is really important, and you should incorporate in your mind when you are entering in a communication station. Now, why I am writing it down as the first quote, because our juniors sometimes they are speaking jargons. They are communicating in a way that the thing is really getting complex when you are explaining something to the patient. So the patient is might be he is just saying okay, okay, I am with you, but actually he is not understanding exactly what you are imparting on him. So communication, the key is it should be crystal clear. Number two, sentences should be very short. Third, you should show necessary. I'm using the word necessary, not unnecessary, sympathy and empathy. Then communication do require you that you should come to the level of the patient to just consider that might be if I am a patient, if I am having no medical knowledge, how I will digest this simple piece of information. Also, sometime might be you are going to buy a car, might be you are going to buy some laptop, something like that. So you are having not a good knowledge of that particular thing, because of course you're a doctor, you have more knowledge in the medicine. What you require from other person, that other person should tell you really from the basic, and should answer all your concerns which might arise in your mind, not only ask, rather manage the concern. And this is the same thing which I was discussing last week, that PACES is not about just asking the concern. Sir, do you have any concern? Yes, I am having this concern. No, you have to manage it adequately, and patient should get satisfied from your narration or your solution. Dr. Sitner, voice is clear, please?
Yes, yes, crystal clear.
Good, thank you. Now, Good communication is a bridge between confusion and clarity. We were discussing a scenario recently, might be in a course 2 or 3 days back, about a scenario in which there was a perceived medical error. Means that there was no medical error and GP was might be diagnosing or misdiagnosing the patient. Right now, the patient was so furious that he was about to lodge the complaint against that GP in the court. Similarly, there are sometimes scenarios in which the disease process is causing the problem or might be complications, and the drug is not, culprit, but the patient is perceiving that might be a doctor is prescribing me a drug which is really toxic. In my real life scenario, I think 2 or 3 days back, I got a patient and he was a known case of CKD and having hepatitis C infection, but yes, he was non cirrhotic. We started him on DAAs, and my junior, I think 2 days back, 3 days back, he was coming to me and saying that that person is saying to me that your drugs are responsible and your drugs are responsible to cause this renal deterioration. And really, I am in a terrible situation because of your drug. I am having fatigue and my creatinine has jumped a lot in last few days. And he was just taking simple DAAs and he was really a known case of CKD. So I need to counsel him and I need to address his concern because now there is confusion and we need clarity. If you are unable to clarify the thing, if you are unable to make the thing crystal clear, what will happen that this concern one day will become a complaint, and this complaint will ultimately be a really, a difficult thing for us when we are doing our jobs, when we are doing other things. So the concerns should be managed adequately. Now, another quote for you: the most important thing in communication is to hear what is not being said. Now, what is this? This is really pertinent to your PACEs. Say, for example, you are seeing a person who is might be worried. You are telling that you are having cancer and this cancer is now widespread, and what you are feeling that now this person is withdrawn, this person is not making eye contacts with you, this person is not now even weeping and even asking any concerns or question, he is just listening to you. Now this is a duty of a good clinician and good communicator to make or bring the patient alongside with him. It is not now that I am just imparting the knowledge that you are having CA prostate, which is now metastasized to the back. And what we are planning to give you palliative radiation and some chemotherapy. No, it's wrong. I need to bring him back. I need to say that, sir, are you with me? Sir, are you understanding me? Sir, I hope I am not overloading you with this information. Sir, if you're not okay, I can give you some time to digest this news. So this is really required in your PACEs. And now, when there is no Viva in this new PACES 23, this will be having a large impact on your marks. And I will explain to you in next few slides. My voice is clear, Kristinder?
Yes.
Good. Just a second. Dr. Satinder, my screen is clear now?
Yes.
Okay, good. Now, what's new in PACES 23 clinical communication? Previously, we were having one station of clinical communication of 14 minutes. Right now, they are incorporating two different clinical communication stations. Each consultation will be of 10 minutes instead of 14 minutes. So you will be communicating 10 minutes in each station and total of 2 stations. And there is no Viva in the end of consultation. So you are entering the admission hall. They will give you scenario. You will be having 5 minutes to read that scenario. You are reading that scenario, then there will be bell. In the bell, you are entering in the room, you will be having 10 minutes with your surrogate or with your patient. And you will communicate and you will get a prompt at 8 minutes that now you are left with just 2 minutes. And at the 10 minutes, there will be bell and scenario will be over. And you will immediately go to next station. So what are its implications and how it will impact you and how it can impact your marks and your passing and failing ratios? We will discuss it in the next slide. Now, what are the new challenges? Number one, the restricted time to cover all aspects. Say, for example, you are having a station in which you have to counsel regarding a simple procedure might be PEG tube insertion in a patient with advanced CA esophagus. Now the time is less, but you have to cover everything. Right now, we have to act in a very smart way, in a very smart fashion, like how we can cover all necessary aspects in this shortest possible time. Remember that the scheme, the skeleton, the platform which I am sharing with you, we need to play with it. We need to adjust our time with it, but we cannot ignore each step of counseling when we are doing a case. Now, second is there will be no candidate examiner interaction to explain your own point of view. This is the really difficult aspect which I am considering in PACES23 clinical consultation. Say, for example, you are missing something. I give you example. The patient is, you are telling first time the son that the dad is having might be cancer, advanced cancer. And you are feeling that the son is feeling so low, or might be he is crying or weeping. Now you are thinking that this is not appropriate time to talk about LPA and advanced directives, so you are skipping it. In the viva, if examiner is asking you, you might have a plea, you might say that, sir, it was not really appropriate time for me to touch these topics because the son was not okay. So you have the chance, you have the time, you have, something in the backup that you can explain or you can tell your own narration to the examiner. Right now, as there will be no viva, so now everything will be relying on your performance. 10 minutes game. You have to prove yourself in 10 minutes of your performance. There will be no backup in the viva, or might be if examiner needs to clarify something, or might be he needs your knowledge, more knowledge about that. So you will not be assessed. You will be assessed only on the performance which you are playing over there in 10 minutes. So practically speaking, you will be having 600 seconds. In 600 seconds, you have to prove yourself that I know how to communicate. I know how to be empathetic, sympathetic. I know how to, apply each ethical consideration or concern in the scenario, and I know all legal implication of each clinical part or each clinical scenario. So this is now your task, and it will be slightly difficult than before, because before that you can rectify yourself, you can tell yourself, or might be even you can say sorry to examiner that, sir, yes, I was missing it and this part was quite necessary and I should say to patient. So you have the backup. Now, right now, you don't have the backup, and this will be difficult to explain your own point of view. And this thing should be kept in your mind. Need thorough, this is spelling mistake, thorough knowledge of following in each case. That is legal consideration, like what are the legal implications of each case when you're dealing with it, ethical consideration along with ethical dilemmas. What are these? Might be the patient is in end of life care and you want to take back something. You want to be on the back foot. You can't now tell everything to examiner, and you should consider that you are dealing with a patient in end of life care. Might be similarly in palliative care when you are quite restrictive in your treatment options. Similarly, the medical issues, you should be very vigilant. What are the medical issues in your each case? Might be you are dealing with person having a UTI. With the UTI, they are giving some aminoglycoside. It is leading to toxic, results like autotoxicity might be nephrotoxicity. So a good clinician will now be very vigilant that I am playing on the three targets, that at one end I have to deal with the UTI concerns, on the other end I have to be vigilant about autotoxicity and renal compromise, or might be acute kidney injury related to aminoglycoside. So the thing is that now you have the 10 minutes, and the good candidate or a good student will take into account everything, because you will be marked by two separate examiners at the end of that clinical communication. Dr. Satinder, my voice is clear?
Yes.
Good. Now, what should be the layout? Because we need to plan something. We need to plan exactly how we will go in that scenario. Say, for example, you have given a scenario of might be multiple sclerosis, and you have to now explain about interferons. So you will make some mind, you will make a plan, you will have some, computer of your minds going on and on, that how I will communicate, I will enter, there'll be a female, and I will be bombarded by multiple concerns, the questions might be, and how I will impart that knowledge about this disease and the management options in given time. So what is the summary, or you can say that what should be the layout or skeleton? It is consisting of three parts. First is introduction or starting. Second is body, that is your main task. The last is the endings. So introduction is almost same for all the cases. Ending is also almost same for all the cases. But the body, the middle part, is really different. Might be right now you have to explain about lumbar puncture, scenario is totally different. Might be you have to counsel the patient regarding genetic disease counseling, this is totally different. Might be you have been given a task to explain about myotonia dystrophica to your patient, it is totally different. So it depends upon your scenario. But yes, this introduction thing and this ending thing is equal. And remember, now we are opening this up. We are now unfolding it, and each and every point over there is necessary in the counseling. Now, before I go ahead, let me give you the example. Patient is a layman, okay? Patient is not knowing exactly what is multiple sclerosis, what are the treatment options, what is the impact of that multiple sclerosis in the future life. I give you example. You were undergraduate student, you were listening from somebody that there's a degree might be, or qualification might be called MRCP UK. You just know by the name that this is MRCP UK, might be some UK qualification. You're going to your senior and you have multiple questions. Of course, you want to know first exactly what is the benefit of this qualification. What is the scope of this qualification? If I am wanting to do that, exactly how many steps were there? What are the study material I have to follow? And also, what is the time duration I must complete all these steps? And also, if I am failing, what are the implications? And if I am passing, say for example, I am passing all steps of MRCP, what is my scope? Not only in UK, might be in your own country, might be in Europe, might be something some other countries. So you are interested in all that. And your senior now should counsel you exactly the information which you require. It now depends upon his counseling. If he is a good counselor, of course, you will be more interested and you will dig out more information. If he's a bad counselor or bad communicator, the things might not go ahead. I give you example. You have MRCP, www.mrcpuk.com website. There they are even writing that what is MRCP, how many parts are there, What is the implication of this MRCP? What are the requirements to appear in MRCP Part 1? What are the requirements for the PACES? Then even they are writing that, what will be the study material you have to follow? And also even what you will expect on the exam day. This is a really a good heading over there. You will reach there, you will be having ID check, you will be provided by your initial, and you will put there, you will go inside two papers, they will break inside. So everything is important. Similarly, we need to incorporate this structure when we are counseling regarding the disease. And what are the important aspect of disease counseling? I am giving you example. Of course, inshallah, hopefully we will be doing the other counseling sessions also, like procedural counseling, genetic counseling, all that stuff in free sessions also, and we are already doing it in our courses. But yes, for now, I am more focused on one prototype scenario in which you will be provided a scenario that this is your scenario, this is the disease patient suffering from, and you have to counsel regarding its management to the patient, to the son, to the family, something like that. Just a second, please. Dr. Satendra, my voice is clear and loud. And what about screen?
Both are okay.
Good, thank you. Okay. Now, this is the skeleton and the structure of a disease counseling, and we have already had the lecture on it, but yes, we are modifying it now according to new station and new PACES23 pattern. And also we have added something, and we have subtracted something from the old pattern, because the PACES is evolving each day. This exam is really standardized, and it is really under strict scrutiny by the competent authorities like RCP and others. So we need to change ourselves regarding the new challenges which are appearing in the PACES. Now the skeleton is, first of all, you have to start with the greetings. Hello, sir, good morning, good evening, and then confirm your patient identity. Am I speaking to Mr. X, 30 years old? Double check. Patient name, patient age, both things. Then explain your role. Sir, I am a consultant from gastroenterology department over there to discuss about your health condition. Might be I am a SHO in the acute medicine. The role will be written on your scenario. Now you have to introduce, then you have to establish the rapport. Sir, I hope I am not keeping you waiting too long to see me today. Or might be how you're feeling today. Say, for example, you are sitting in the train and first time you are meeting something, or might be in a bus, you are not starting like that. How many kids do you have? Are you married? Where do you work? No. You start with something. I think the journey is going so good, bus is so good, and might be you're feeling like that the AC is going so good, and this is really a good services provided by this train people. So something like that. You're opening up the conversation. Similarly, you are over here some establishing a rapport before starting. This is a very big mistake in our courses, that the candidate is starting telling straight away that your dad has died and we have decided to take out the organs. Such a bad impact. And he is not even aware that the dad is no more there. Sometimes he is saying that you are having a cancer, which is quite widespread and is not amenable to treatment. And we have decided to put a large PEG tube in your tummy. And he is getting collapse over there. Totally wrong way. And each and every step will cut your marks brutally. So first open up the scenario, establish the rapport. By saying that, sir, I hope that you're comfortable over there, or might be, sir, how you're feeling today, something like that. Then set the agenda. Sir, we are over here to discuss about your health condition and its management. And also, I will be more than happy to answer all your concerns and questions if you have to ask. So like that. So agenda, why you are meeting is important. Say, for example, you are talking with a son, you are talking with a daughter. You will say that we are over here to discuss about your dad's health condition and its management with you if this is okay with you. This is okay with me. And also, sir, let me inform you, I have already taken the permission of your dad to talk with you about its health condition and its management. So you are basically giving a message over there that I know that patient confidentiality must not be breached. So you have to say this. Ultimately, you have to assess understanding and apply the ICE. What is ICE? This is really important. And my teaching experience states that if a candidate is not applying the ICE in the start, scenario is a big failure. I will give you example. You are Dad is coming for might be achalasia dilatation by endoscopic methodologies, and you are counseling the patient that the dad is no more, and we are planning for might be postmortem. So scenario states that the person is collapsing during achalasia dilatation, and our team is also confused what has happened, and we have planned for postmortem, corner postmortem. And you are starting straight away that, sir, your dad has expired in the is having a table that, and we are planning for postmortem. He is even not aware that the dad, why the dad was there in the hospital. He is coming from America, might be. He is not aware
Dr. Salman, your voice has gone. Hello. Hello. Dr. Salman. Hello. Hello. Dr. Salman.
Hello,
Yeah.
Dr.
Hi.
Satinder. Is it clear?
Your voice was gone for last few minutes for
Is
two
it
minutes.
clear now?
Yeah, it's clear now.
Is it okay now?
Yes.
Good, very good. Okay. Are you able to see my screen now?
Yes.
So I was talking about the ice, right? You people were listening to
Yeah.
it.
Yeah.
So you
It is
have
that.
to take the insight first, like how much he is knowing about the that. Okay. Now this is ice. I for idea, C for concerns or expectations, and E for explanation. Now I for idea. What you have been told so far about your health condition. Might be he is aware that he's having cancer. Might be he is not aware that he's having cancer. So you will get an insight that how much information he is already retaining. Second, do you have any specific concerns or expectations from our meeting? Might be he is just coming to you for genetic counseling. Might be he is coming to you to know exactly what's wrong with the dad. Might be he is coming to you just to get the insurance paper signed. So you have to ask what are the specific concerns or expectations from today's meeting. This will give you idea exactly in which direction your case will move. Then E for explanation, and in explanation your task will start. So we started from there. This is introduction. So we are doing all that stuff, and this is almost same. Then you are going ahead with the ice, you're applying the ice, or the next is body. I was giving you the example that we will have this scenario might be of a condition like, say, for example, Parkinson's, say, for example, stroke. And right now, the task is to counsel the patient regarding its disease and its management. Now, how to do that? This is very important. First of all, you have to say to patient, sir, you are having a condition called rheumatoid arthritis. Don't bother by the medical term. This is the condition in which. Second step is to explain pathophysiology. Nobody is saying to you that you will go in the medical details. Just explain a pathophysiology in the shortest possible way, in a very crystal clear method way with no medical jargons. Say, for example, you are dealing with might be rheumatoid arthritis. So you can say that, sir, this condition is a condition in which your defense system is misdirected and it is attacking different parts of your body, particularly joints. Finish. Why to go in more details? Just you are giving the idea that the main culprit is immune system. The main culprit is a defense system which is now misdirected. Might be you are explaining about dementia. So you can say that due to unknown reason, your dad brain is having premature aging. It is getting old, might be prematurely. Say, for example, you are explaining what I can give you example. Ulcerative colitis, similar fashion, that your dad is having a soreness in the bowels and which is leading to tummy pain, fevers, bleeding, and it is happening because of misdirected defense system which is attacking the bowel. Simple way. And it will maximum take your 15 to 20 seconds. Then you have to draw. It is really creating a very good impact on examiner if you are drawing something. Say, for example, the scenario is that you have to counsel for ERCP. It might be the scenario states that you have to counsel the patient for ERCP and stenting, a metallic stent, and the patient has already been diagnosed as the case of metastatic cholangiocarcinoma might be. So now it will be very better if you can draw a just sketch. This is liver, this is CBD, this is small gut, and we are passing ERCP through your mouth, in the tummy, in the gut, through their cannula going up, and we are putting stent. At least this procedure, if you can draw, this is more better. Similarly, if you are counseling for might be diabetes, it will create a very good impression on the patient as well as on the examiner that you can draw that, sir, this is pancreas, the gland which is producing a protein called insulin. This is your stomach or tummy. Food is entering from the tummy in this blood channel. I am drawing this blood channel in front of you. From this blood channel, sugar or food is supposed to be transported inside the body, and this protein called insulin is helpful. Unfortunately, this protein is deficient in your body. Finish. Dr. Satinder, voice is clear?
Yes.
Good, thank you. So the third is the clinical features. So you are telling that this condition called rheumatoid arthritis leads to soreness, swelling, pain, stiffness in the joints. But the point is, the story is not finishing over there. If you are stopping your story over there, if you are stopping it over there, your counseling is really incomplete. Why? Because the next step is to tell the associations and the complication of the disease. I give you the example, this patient might be having right now or might be after 10 days, 15 days, 6 months, uveitis. He will not get idea that it is linked to rheumatoid. Might be he is having something called Felty syndrome. Might be some other complication. So you should tell. Now you know very well that this rheumatoid is associated with IBD also. So you have to tell the association. Similarly, say for example, you are counseling a patient with ulcerative colitis and you are telling the associations that might be you can get red eyes, oral sores, might be you can get some rashes on the body, some soreness on the body, some low backache. Finish. Good. You are telling all features, but you are not telling association that unfortunately this UC, ulcerative colitis, is do associated with CA colon also. And if you are not counseling it right now, he will never present you back after 10 days for screening colonoscopy. So this is the first meeting with your patient, and you have to tell the things in a shortest possible way. But when you are telling it, now it's time to give some hope also. How I'm explaining you. Next is prognosis. Now the disease might be curable, might not be curable. And I hope you all know that this is an ethical principle that we should be truthful to the patient. You have to say truth. You will not speak a lie that this condition is curable or this condition is treatable. Say, for example, you're talking about rheumatoid, you're talking about ulcerative colitis, might be you're talking about multiple sclerosis. So you will say that, sir, unfortunately, this disease is not curable but manageable. Not curable, but we have a good experienced team in this regard, and they do know how to manage the patient with these chronic condition. And yes, multiple patients with these condition or this condition is having near normal life. So you have to give the hope also, but no false hope. No false hope. Without giving any false statement. Why? If you're giving one false statement, it will really eradicate your marks. My voice is clear?
Yes.
Good. So you are giving a realistic hope. Say, for example, if you are thinking that might be some research work is going on in a particular field, you can say that, sir, for now, there is no cure available, but yes, few studies are going on, researches are going on. Might be one day we will be able to find the cure. But one thing is for very sure that the symptom of this condition are manageable. Our teams are expert and we have expertise to deal such patients on daily basis, and we will not let you suffer. Now, still we are in the skeleton, how to counsel. We are doing a counseling for a particular disease and its management. So we are discussing the same skeleton, same structure. Tell about the alarm symptom as the part of safety netting. Might be the patient is having ulcerative colitis and is in flare. It will be a blunder on us if we are not telling about toxic megacolon. Say, for example, the patient is having stroke. It will be a bad blunder if we are not telling the patient the risk of re-stroke. So, in that regard, the alarm symptom, I'm not talking about the disease, the alarm symptom. Say, for example, you're having bad tummy pain, tummy distension, might be toxic megacolon, might be unable to pass flatus, then might be if you're talking about, say, for example, multiple sclerosis, that anytime your vision is getting lost or something like that, feel free to contact our ER. Safety netting means you are providing some support, you are giving all precautions to the patient before he is leaving your chamber. Now it's time to explain the management plan that is pharmacological, but you must restrict yourself in the option which they are providing you. They are saying to you that please counsel the patient for warfarin. The patient is having DVT. At any cost, you will not cross the limitations. You will not cross the recommendation of the treating team. You will not say that, okay, docs have the option also. I can prescribe you docs. Say, for example, the patient is having type 1 diabetes, and the consultant or treating team is writing down that you have to counsel about injectable form of insulin. You will never provide the option of insulin pump. And these are the common mistakes in our courses. So I'm warning you that you have to restrict yourself in your scenario. But yes, there is one exception. The exception is that some things are understood. Some things are really crystal clear, even if they are not being provided by the scenario or by the team. Say, for example, your consultant is counseling, saying to you that please counsel the patient for methotrexate. It is understood that you have to give folic acid. Say, for example, the consultant is counseling you, saying to you that please counsel the patient for LP. This is understood to offer fundoscopy before that. Say, for example, your team is instructing you to please talk with the patient and counsel regarding warfarin. It is really understood that you have to bridge it with heparin because warfarin do take some time before the onset of its symptoms. Sorry, its work. So it is really important. Now, other second point is explain the management point plan in non-pharmacological way. Now, what are the non-pharmacological ways? There are multiple ways. You are counseling a patient of the Parkinson regarding anti-Parkinson drugs, and you are not providing laceless shoes, buttonless shirts, special cutlery, no rugs at home, physiotherapy, sport near the toilet seat. This will be a blunder. You are talking about a stroke patient and you are least bothered about postural change, air mattress, physiotherapy, adequate feeding. It will cut your marks. So non-pharmacological things must also be mentioned. Say, for example, you are counseling the patient for warfarin and you are least bothered about drug interaction. You are least bothered about grapefruit juice, pomegranate juice, other stuff which are interacting with the warfarin. It will create problem for you in your marks. So, non-pharmacological methodologies, non-pharmacological sports in the form of sports, in the form of physiotherapies, in the form of might be counseling, might be some, you can say that some sessions, it is really required for you, required by the exam. Now, next is consider the pregnancy and fertility issue. Say, for example, you are counseling a patient and you are giving a drug which is really toxic in the pregnancy and you are least bothered, it will cut your marks. So, whenever you are dealing with any condition, might be MS, might be any condition which is chronic condition, even acute condition, it is must for you to ask yourself, are there any special implication of this disease in the pregnancy or not? Are there any specific implications of this disease management in the pregnancy or not? Sometimes you have to change the drugs. Sometimes you have to instruct the patient that I am starting this medication, but yes, if you're getting pregnant at the first sign, you will get back to me and I need to change your medications or might be dose. It's very important. Dr. Sitendra, voice is clear?
Yes.
Good. Now, first time again, we are asking the concerns. So do you have any specific concerns? Use the word concerns. This is my advice to you. Do you have any concerns? Do you have any questions? Both have the same meanings. But because the word concern is mentioned in your mark sheet, so better is that you should give a message to examiner that, see sir, I am asking the concerns of the patient. Now when you will be asking the concern at this point, there are two possibilities. I am telling you beforehand. One possibility is that might be, say for example, right now I am asking the question from Dr. Sitinder. Dr. Sitinder, do you have any concern question? Now there are two possibilities. One possibility is that Dr. Satinder is asking questions about what I have already discussed. Or might be he is about to ask me questions which I have not yet discussed. So if he is asking the question what I have already discussed, so I will answer it in a shortest possible way, and I will keep in my mind exactly where I am leaving or pausing my scenario. So if he is asking something which I am about to explain, say for example, you are reading over there in my uh, screen that we have to refer the patient to sports group or societies, might be he wants to ask which societies. So I will say that, sir, I will be in a better position to answer this question in next few minutes. So in this way, you will save your time. Then consider the impact of diagnosis in activities, hobbies, family life. So this thing might be, it can be skipped. If say, for example, you are running out of time and you have really restricted time, you can skip it. But yes, touch it. Say, for example, you cannot miss this part. You cannot miss this part. You cannot miss this part even if you're appearing in MRCPI or MRCP PACES. You can't skip it. If you are dealing with any condition which do have impact on the pregnancy or might be fertility issues, you cannot skip it. So it depends upon your scenario. According to that, you have to modify. Then necessary referrals, even it can be skipped. It depends upon which condition you are dealing with. You are dealing with might be dementia, so you need SALT teams, speech and language therapy teams. So you can, say to your patient that I will make a referral to those teams. Say, for example, might be you are dealing with diabetic patient, you need adequate referral to clinical dietitian regarding proper diet charts. So it depends upon your scenario, but a referral should be informed to the patient. Refer to sports group and societies. Also, it is really important so that they can seek some help or seek some support. The like-minded people, like-minded person, you all people are added in multiple PACES groups. Why? Because you are discussing your problems. You know that if I'm having this question, I can ask to others. I am remaining updated with the changes. So you should also refer them to the like-minded group, like-minded people, and like-minded patients. Now we are touching the third part of our counseling, that is the ending. Again, the ending is almost same for all the scenarios. Social history, it is sometime necessary, sometime not. Usually when you are doing counseling from a chronic condition, it is must for you to know exactly whether your patient is smoking, might be alcoholic, how is the social support, financial support. So this is at least require these four questions. Smoking, alcohol, because these two conditions do have interactions with multiple drugs, and also they do have some implication regarding the disease also. Secondly, social support, financial support. Now it is a really important, and it is really a big and common mistake in our courses, that candidate is not exactly knowing how to ask the social support and how to provide it. First is, sir, Say, for example, the patient is Parkinson patient. Might be the patient is having bad osteoarthritis. So social support is really must for you to require to ask and to give. So, sir, who is taking care of you at home? First question. Second question, how is their health condition? Because might be he is saying to you that my son is taking care of me at home and the son is having some bad chronic condition. So you have to adequately ask who is taking care, how is their health, and if there is no social support, you have to motivate the patient. Is there possibility that you can arrange, might be your family members or your relatives or friends to take care of you at home? And if he is still saying yes, now it's a time to say that I will immediately talk to our social health teams and see how we can help you in this regard. This is the stepwise process. Similarly, sorry, there should be not social support, there should be financial support. This is wrong, this is repeated, so this is financial support. So how you are taking care of your finances, because might be he is not able to visit the office because of some chronic condition. Patient is in the dialysis, patient is undergoing dialysis in the pilot. He can't do that. So you have to say that I will immediately talk to occupational health physician and see how we can help you in this regard. Remember that occupational health physician is someone who is assessing the risk, the industrial risk, providing you with the leaves, or might be making some recommendation for the light job, light work, and also might can write down that you can be relocated back on some desk job, might be. So this is really important. Then there is occupational health therapist. He is something different. He is having some different role, and candidates are commonly confusing it with occupational health physician. Therapist is someone who is making changes in your body, in your home, in your surrounding, in your working environment to help you to cope up with this disease. Might be there is no sport in your home for you to properly walk, he can provide that. Might be there are some no special cutlery or instrumentations are available for you to cope up with the bad tremors of your Parkinson, so he can help you. Similarly, might be the patient is having occupational asthma, so he can visit that place and make some changes, or might be provide you with some equipments over there. So this is they do have different role. Occupational health physician has its own role, and occupational health therapist has its own role. Again, guidance regarding follow-ups. It is really important. You are taking a new car, it is a brand new from the showroom, and they will always give you some instruction that, sir, you have to come back at 5,000 kilometers, might be, then 10,000 kilometers, might be. We will do oil checking, we will do some simple tuning, something like that. Similarly, for the patient, say, for example, you're dealing with diabetes and you are least bothered about providing the follow-ups, this will be a big blunder. Might be this is the first time you are discussing the disease with the patient, so you have to adequately provide with this follow-ups, like you have to follow regularly with your gland doctor, but yes, yearly basis follow-up to the kidney doctor, yearly basis follow-up to the eye doctor for your eye examination, and yearly follow-up with the foot doctor. Re-ask the concerns, use the word concerns. So do you have any concerns up till now? Sir, are you with me? Sir, are you understanding exactly what I'm speaking? That's a good thing. So if he's asking any concerns, you have to answer. So in the end, you have to provide with the brochure, leaflets, web addresses. You will simply say that, sir, at the end of this consultation, I'm going to provide you written instructions, brochure, some leaflets, and some web addresses for you to visit so that you should read more about your health condition and you should be well versed regarding exactly what's wrong with you. Then in the end, provide hospital contact details if you have any. Say thank you to the patient, thanks to your examiner. Now, before I go ahead, we have one issue of summary. Sometimes the candidate is summarizing, but it is the really not required. It's a good impression. It is leaving you a good impression if there is summary of the case. But say, for example, if you're running out of time, then instead of going for summary, my personal suggestion is that you should cover all these points which are there on your screen. It is really important. So, how to summarize? Summary will be provided by the patient. You will say, sir, can you please summarize exactly what you have understood from our today's meeting? You will summarize. If he is missing something, you will add and adequately say thanks to your patient. Dr. Satyender.
Yes, yes, Dr.
So
Salman.
we will be having now your station 4 scenario, and I will give you full 5 minutes to prepare this case well.
Okay.
Make your notes, prepare it well. Then I will get back to you, and you will be having total 4 to 5 minutes. Read this case, prepare this case, and then try to apply all these principles, all these points, all these guidelines in 10 minutes. So you will be having a total right now 4 to 5 minutes to prepare this case. Then we will start the scenario and you will be provided 10 minutes with your surrogate and I will prompt you at 8 minutes. Clear?
Okay. Okay.
Good. So I am sharing my screen for you. Are you able to see my scenario?
Not till now, but I can see your screen. Yeah,
Read
yeah, I
it.
know.
And
Yeah.
I am holding my mic and I will be back to you in 4 minutes. Okay?
Okay.
Okay. Dr. Satinder, are you ready?
Yes, yes, Dr. Salman, I'm ready.
Good. So now this is PACES 23 clinical communication.
Yeah.
Principles are same, methodologies are same,
Mm-hmm.
time is restricted, and
Mm-hmm.
you are supposed to cover all the aspects of necessary counseling
Mm-hmm.
along with the taking care of the legal and ethical issues of this case.
Mm-hmm.
I am giving you timer and your time starts now.
Hi, I am Dr. Satinder. I am one of the doctors here. Could you please confirm your name and age?
Yes, my name is Sadi Khan, and I am 34 years of age.
Okay. Good evening, Sadi. I hope you didn't have to wait very
Good
long.
evening, Mr. Sadi.
Okay. Good evening, Mr. Sadi. I hope you didn't have to wait very long before seeing me.
Thank you so much for your concern, doctor.
Mm-hmm. Uh, so, yeah, please tell me, how are you?
I am better. I am fine.
Mm-hmm. Okay. So, Mr. Sadi, today we are here to discuss about your health condition, and uh, I would like to know how much do you know about that?
Nobody is bothered to tell me anything except that they are giving me some creams to apply on these scales. I am suffering. I am having this bad itchy rash and it is quite scaly and is spreading like a wildfire. I am again and again going to my GP and telling him that these creams are not working on me. But nobody is even bothered to tell me exactly what's wrong with me and how it will get cured.
I'm sorry, Mr. Sadi, that you have not been told yet about your condition. I would try my best to explain and everything about your condition
Just
today.
one thing they are saying that you are having some psoriasis thing might be. I even don't know how to pronounce it.
Mm-hmm.
And they're saying it will never leave you till you enter in your grave. I need your help, please.
Okay, Mr. Sadi, I'll try my best to explain it to you. So, uh, so Mr. Sadi, you have a condition called psoriasis. It is hello.
Yes, yes, go ahead.
So there are psoriasis is of many types, and it is a condition of skin.
Mm-hmm.
You have a type of psoriasis which is called as plaque psoriasis,
Mm-hmm.
and this is a condition in which your defense system, your defense body's defense system, which is actually normally works against the bugs, it is attacking your own body parts, mainly the skin.
Mm-hmm.
In such condition, the skin becomes scaly and sometimes itchy also, and it is quite widespread.
Mm-hmm.
Uh, it may be sometimes it may sometimes affect the joints also, along with
Mm-hmm.
nails.
Mm-hmm.
In your case, the GP has already tried some creams
Mm-hmm.
that included the steroid creams and some other medications,
Mm-hmm.
but that has not worked.
Exactly. This is what I want to explain to you.
So, Mr. Sadi, sometimes this condition can be very resistant, and it's not easy to treat.
Do you think that there is any cure available for it? And also, do you think that the underlying reason can be treated or corrected?
I'm sorry, Mr. Sadi. It cannot be corrected completely, but yes, it can be controlled with some medications.
Mm-hmm.
In our team has decided that you should be started, or you should be given some oral tablets. Those are called as methotrexate. Don't worry about the medical terms.
Are you in your senses? Are you sure that you're about to start, cancer medication, the medication which my dad was taking whole life? And my dad was not getting expired with the cancer. He was getting expired by this bad medication.
Oh, I'm sorry, Mr. Sadi. I I understand that you are aware about this medicine, which is also used in cancer. But let me reassure you, this is given in cancer at a very high dose. But in your case, it will be given for at a very low dose and for a very limited duration.
Mm-hmm.
And once your condition is controlled with this medicine, you may be your dose may further be decreased,
Mm-hmm.
and the dose which we will be giving you, there are very the chances of side effects are much less.
Can you give me a guarantee that you are starting, cancer medication, a low dose for shortest possible duration?
uh,
Can you give me guarantee that
I'm
there will be
sorry.
no lethal side effects?
I'm sorry, Mr. Sadi. Side effects are quite unpredictable sometimes. I cannot give you any guarantee, but yes, I can say that at this dose, the side effects will be minimal.
Okay.
And if there is
I
any
am really bothered to know the side effects.
Okay, so Mr. Sadi, so the most important and the most common ones are the gastric side effect, which means the feeling of sickness and sometimes gastric acid reflux. The other major side that can be controlled with the help of some gas pills.
Mm-hmm.
Others important side effects which include are the which are uh, uh, problems in the fertility,
Mm-hmm.
and it is recommended that if that you should not plan child you should not plan your family or child in, till the time you are taking. You can plan
What
your
you're talking about?
Mhm.
The pregnancy doctor, might be you're saying it as a gynecologist, is instructing to my wife to plan the kid as early as possible because we are getting overage. And she
Mhm.
is saying us to do it as early as possible because she is having PCOS.
Mhm.
Don't give me this medication.
Mhm. I see. I understand, Mr. Sadi. You are quite concerned about that. What we can do, we can talk to, we can have a multidisciplinary team meeting with the with your uh, uh, pregnancy doctor, and we can plan about it. There is a facility available of for storing your sperms, and that can be used later on for pregnancy.
How
Will it?
they will be used later on if they are frozen 2 minutes from now?
Mhm. So, Mr. Sadi, that is possible. We can have a discussion later on in a multidisciplinary team meeting with your pregnancy wife's pregnancy doctor. Uh, will it be all right, Mr. Sadi?
All right with me.
Okay, okay. So I would like to ask you some more questions, Mr. Are you concerned about anything else, Mr. Sadi?
I am concerned about multiple things.
Yes,
I
please.
need to know exactly for how long you're giving me this medication and how I will know that this medication is now like a poison on my body.
Mhm. Okay, so Mr. Sadi, first of all, uh, we need to control your symptoms. Once your symptoms are controlled, this the dosage of the medicine will be decreased, and even with the further in further meetings, we may even be able to stop this medication, and we can switch you on some other medications, and the side effects are should be minimum at the dose which we are going to give it to you. Is there anything else which you want to ask, Mr. Sadi?
Nothing else. But
Okay, Mr.
might be I want to give a try to a Chinese medication prescribed by my good doctor friend from China.
Mr. Sadi, those medications are not approved as of now, and these are not available through our NHS also.
Okay.
I would suggest you not to take them because we have treatment available in NHS for this condition.
Okay.
Mr. Sadi, do you smoke?
I love smoking.
Mr. Sadi, I would suggest that the smoking will be injurious to your health, and it might even complicate the situation. I would suggest you to stop smoking. If you are interested, I can refer you to a smoking cessation clinic. Do you
Okay.
do you take alcohol, Mr. Sadi?
No.
Okay, so Mr. Sadi, I will provide you some. Do you have you had any problems in your? What do you do, Mr. Sadi, for living?
I am a businessman.
Okay, are you facing any difficulties in business because of this condition?
People are saying me that you are having some fungal infection on your skin, and I am
Mm-hmm.
unable to wear the t-shirt, and I am unable to go to gym.
I'm so sorry about that, Mr. Sadi. What I can do, I can refer you to the occupational therapist. It might be able to help you in this regard. Uh, okay.
Time is up. PACES23 consultation is not followed by the Viva. You will be judged and marked by two separate examiners based on your communication skills and narration. Why you are referring now this will not be in the PACES. Now I am teaching the scenario.
Mm-hmm.
Your station will end there. You will move to next station now. But I
Okay.
am providing you feedback. Why you
Mm-hmm.
are referring this patient to occupational physician?
Uh,
Mm-hmm.
Maybe he might be able to help.
What help will he provide in the business?
I don't
What
know.
if I am saying him that likely I'm expecting this methotrexate to improve your rash, and once it is improving, we can even prescribe you some camouflage creams for your skin, and you will be able to wear t-shirt and go to gym again.
Mm-hmm.
Don't you think that it is more better?
Yeah, yeah.
Are you telling about a common side effects of this methotrexate, that is low blood counts,
I missed that.
nausea?
I Yeah, I mentioned about nausea, that feeling of sickness.
No, you okay, you mentioned. Okay. Are you talking about liver scarring, lung scarring?
Mm-hmm. No.
Mm-hmm. Okay. Are you instructing your patient to keep the skin moist? Moisturizers, emollients, non-pharmacological ways?
Mm-hmm.
Are you trying to say to him that there is Koebner phenomena and this rash is spreading like a fire if he's scratching over there? He must not cause trauma to the rash. No
Mm-hmm.
scratching. Are you instructing regarding the sunlight? Are you providing him all the red flags if he is on the methotrexate that he should immediately get back to us? If he is having bad sore throat, bad fever, might be neutropenia,
Mm-hmm.
bad bleeding from the gut, who knows, might be pancytopenia, SOB, lung scarring,
Mm-hmm.
cough, dry cough. Are you providing any red flags? Any alarm symptoms?
Mm-hmm.
Good. Okay. So let's unfold this case, and I will do this case with you exactly according to the skeleton of the history, sorry, not history, the communication which we have just discussed. Okay,
Yes, yes.
let's unfold it. And this is my screen, and this was the scenario if anybody is not seeing it. Okay, so what are the important points to see when we are sitting outside? 34 years old, Mr. Sadi, known case of plaque psoriasis, covering 15% area of the body, already on clobetasol and topical tacrolimus, not being satisfied. Now it is increasing, disease is progressive. Oral methotrexate twice weekly, twice weekly, twice weekly. My candidate is not mentioning it to patient.
Right.
Big mistake. Sorry. Then the task. Condition, management, methotrexate. So I am starting this scenario. Hello, sir. Good morning. Am I speaking to Mr. Sadi, 34 years old? Yes, I am. Sir, I am Dr. Salman. I am the resident in rheumatology clinic. They will give you the role over there. I'm not giving you, but they have written over there. So I hope I am not keeping you waiting too long to see me today. Sir, how are you feeling today? Are you comfortable? Yes. Sir, now I am setting the agenda. Sir, we are over here to discuss about your skin condition and its management. And also, I will be more than happy to answer your any question if you do have. Is this okay? Yes, it's okay. Next step is to apply the ICE, ICE, idea, concerns, explanation. So what you have been told so far about your health condition. Now there are two possibilities, Dr. Swetender. Either he is knowing exactly that he is suffering from psoriasis, might be he is not aware. So if he is well aware, then of course your task is now half. Not knowing, it means that you have to do a rigorous task now. So he's telling that I have not been told much about this condition. I need knowledge. And also, do you have any specific expectations from today's meeting? Might be here the expectation that people are saying me that this disease can spread from one person to other person. People are not comfortable with me. I am worried. Might be I can give this disease by the skin touching to my kid. Might be something like that. So you have to rectify those misconceptions or expectations or concerns. Okay. Third is ICE, idea, concerns, E for explanation. Now our task is starting. Sir, I appreciate that you are aware of the fact that you are having some sores and scales on your skin, and you have been provided by some creams, but I'm sorry that you are not well aware of exactly what's wrong with you. Sir, you are having a condition called plaque psoriasis. Don't bother by the medical term. This is a condition in which your defense system is misdirected. It's the same system which is attacking the bugs entering in your body. In your case, it is misdirected and attacking different parts of your body, primarily skin. Also, it can attack on the nails and the joints. As a result, you are having increased rate of growth of your skin, leading to sores, itching, and scales. This disease can also involve nails. Nails can get broken and separated. Sometimes in rare instances can involve joint with joint pains and even lung scarring. Very rarely leaky valve problem, leaky heart valve problem. I am telling disease, pathophysiology, disease, clinical features and association. Sir, unfortunately, I'm sorry to tell you that this disease is not curable, but well manageable. Let me assure you one thing, our teams are highly expert in dealing such patients which are really following us, us up in our OPDs. Many of these patients, rather majority of these patients are leading a near normal life. Clear?
Yes.
We will not let you suffer. We will not let your life disturbed because of this disease. I will guide you. We are with you in this whole journey to help you coping up with this chronic condition. You're giving some hope also, and you're not giving any false hope. Clear?
Yeah.
Good. As those creams are not working for you, and this rash is quite widespread now, our team has decided to start you on a medication called methotrexate. And you have to take it only twice weekly. No, I will not take this medication. I am leaving this room. I am always teaching my candidates. Whenever there is a why, whenever there is no in your clinical communication station, ask why. I will not stay in the hospital. I will not take this medication. I will not do this. Always ask why. Why will generate concerns? Why will generate questions? Why will give you hidden agendas? Because my dad was a cancer patient. He was not getting expired by the cancer. He got expired by the bad side effect of this methotrexate. Sir, I am so sorry to listen about your dad, to hear about your dad. And let me explain to you exactly what this medication is all about. Yes, choice will be yours, and you have to make this choice if you agree with it. So you are saying that you will make choice. I am not forcing you. But yes, if I am giving you methotrexate, Dr. Satender, will you be able to take it immediately?
No.
At least I will never take. I'm telling you myself. Somebody is giving me steroid, I will not take. I'm a doctor. You're a doctor. Why? Because we have concerns. Nobody will take. So now this is the art, and this is exactly what they are looking from you in your PACES, how well you can convince your patient. Sir, I appreciate that you are bothered about this medication. Let me explain to you if you can give me a few seconds. Dr. Satender, my voice is clear?
Yes, very clear.
Good. Sir, this medication is a double-ended sword. At one end, it is suppressing the misdirected defense system. At other end, it is also decreasing the rate of growth of your skin. And we are expecting that after taking this medication, your rash, itching, unsightly skin will be gone. And your disease will be controlled. Sir, I appreciate that you're bothered about the side effects, but let me confirm one thing for you, that this medication is being used not only in the cancer patient, but in multiple other conditions also. We are giving this medication for shortest possible duration and in the very less dose in your case. We just need to suppress this rash, and once it is getting in control, immediately we will shift you to some other medications. Clear?
Yes.
And in this less dose and less duration, this medication is causing least side effects. It is very easily tolerable. And You're concerned about this rash. You're not comfortable with rash. It will get improved and you will feel marked difference. Now, again, he is not agreeing. You will say that, sir, for your concerns, and it is our protocol that we are always making sure that the patient body is ready to accept this medication. For that, we are taking out some bloods, some imaging, and also we are doing these tests repeatedly every monthly when the patient is on this medication so that you are not getting any bad side effects. Clear?
Yes.
And you are missing this part.
Mm-hmm.
You're always going for CBC, LFTs, imaging, chest imaging before starting methotrexate. Even you're following it up and you're missing this part in your counseling.
Mm.
So anytime we are feeling that there is something wrong with your test, and also if you're getting any symptoms, we will immediately stop this medication. Now, what are the side effects? Big mistake over there also. Candidates are telling hair loss, nails loss. They are bothered about lung scarring. What is the common side effect? Say, for example, right now I'm taking methotrexate after your session. What you are expecting, what I will feel after 1 hour? Tell me, Dr. Sudhinder.
Yeah, nausea and vomiting mostly.
Nausea, vomiting, irritation, all that stuff. And other common side effects might be I am getting this pancytopenia, oral sores, sore throat, fevers. But tell about this. Lung scarring, this, liver scarring, they will happen after months and months. Clear?
Mm-hmm. Yes.
But yes, we need to also tell them. But most common and most expected side effects should be explained earlier.
Mm-hmm.
And we are already planning to give you some tablet called folic acid and some tablet for your vomiting so that you must not suffer. This is already in plan. So this is understood. You have to say this with the methotrexate counseling.
Okay.
After telling side effects, you will say that, sir, are you planning for, first, are you married or in a daughter relationship? Are you planning for the baby? Yes. So this medication is not safe for the babies, for the pregnancy. So I instruct you to use double contraceptive method when you are taking this medication and even for the 3 months after completing the course of this medication or after stopping it. Clear?
Yes.
Good. No gynecologist is instructing my wife to plan pregnancy as early as possible. She is having PCOS. See that? So your concern is really valid to me and I appreciate it. I will offer you option of sperm bank. You can deposit your sperms over there and you can plan pregnancy by the artificial means. Your sperms will get placed inside the womb of your wife and you people can have normal pregnancy. Clear?
Yes.
Good. No, I will not take this medication. I will lose hairs. I will lose nails. I am a model. I am doing modeling.
Mm-hmm.
Sir, I appreciate your concern. We can provide you with artificial hairs and artificial nails. And yes, they will look like real. And also, even if you're losing them, you will immediately regain them once we are stopping this medication. And also, as previously said, this medication is given for shortest possible duration. Clear?
Yes.
If you have time, take social history. No time, no worries. Say that smoking and alcohol we are always considering before starting this medication. Finish to give the idea that yes, I know I have to take this, but I am restricted from the time. I am referring you to some sports group also providing you brochure, leaflets, web addresses so that you should read more about your condition. Thank you so much, sir, for your time. Thank you so much. Goodbye. Goodbye. If you have time, you can say to him that summarize what you have received, the information from our today's meeting. He will summarize, you will not summarize. Clear?
Yes, yes, Dr. Salman.
Good. Any question, Dr. Sutinder?
So this is just a general query. The scenarios are same, right? Which were earlier in the normal in
No guarantee. Really, no guarantee.
Because I was concerned because
Why? I am telling
yeah.
you. First of all, what they require from you. They require from you how you can deal with the angry patient, how you can explain management plan to patient, how you can explain a disease to patient, how you well know exactly how to deal with the DNAR scenario, how well you are, expert in dealing with terminal illnesses in the patient, how well you know how to deal with genetic counselings. So there are multiple scenarios, okay? But it is not really required by the RCP that they are giving you one scenario, it will be repeated in the next diet. No, never.
Oh, no,
But
no.
one thing is for sure that you should know exactly how to counsel for any disease and its management.
I was just concerned about the time actually, because earlier the scenarios were designed for 14 minutes. Now they are designed for 10 minutes. So they must be expecting a concise talk, right?
Absolutely, your concern is very valid. So we need to act smartly. How we can concise the thing in 10 minutes by avoiding unnecessary details. Like smartly, I am dealing over there that I am not going in the details of social history, just touching it. Say, for example, I am not going in the unnecessary details of how this disease is impacting your social life, how it is impacting your hobbies, because I know that other points are more important to cover. Clear?
Yes.
Secondly, likely they will give you more time to speak. Might be concern will be less, so that you concise your scenario in 10 minutes. But yes, it doesn't mean that you are skipping important points, what I am explaining to you in each counseling. Counseling should be a complete package.
Right.
Thank you, Dr. Sundar, for your participation and your questions. Anybody wants to ask any questions, queries, confusions, problems, issues, you can use the option over here of raise the hand. You should raise the hand and I will unmute you.
Thank you, Dr. Salman. Shall I mute myself?
Yes, you can. No issue.
Okay.
Any questions, any queries, any problems, any issues linked to communications or linked to this scenario? Okay, if there are no questions, no more questions, we should conclude our session. Have a good night and goodbye.